Hey everyone, my name is Patrick and I'm one of the curators of the Quilt exhibition, and I'm delighted to be joined by Bill Foley, one of the founding members of Gay Health Action back in 1985. So Bill, I suppose we're fortunate in today that medicine has come on and HIV and AIDS is no longer a death sentence like it once was, but going back to 1980s, what was it like in Ireland at that time and how did Gay Health Action come about?
I suppose the late 70s and 80s were a very dark time in Ireland politically. We weren't very progressive back then. There were limitations on human rights everywhere, both for women and for gay men, for all the LGBTI spectrum. So a group of us got together and formed the Dublin Lesbian and Gay Men's Collectives way back in 1980. And we formed part of a left alliance where we were out on the streets protesting various social reform issues every week. I suppose that organisation was mainly responsible for doing the Declan Flynn march, the protest march in Fairview, which kind of reignited the Pride parades. We also formed protests outside Pearse Street, Garda Station, when there was a massive investigation into the Charles Self murder, and what you producer, where the investigation brought in huge numbers of gay men for interview despite not fitting descriptions of the alleged killer and so on. And then we published a book in '86 called Out for Ourselves, The Lives of Irish Lesbians and Gay Men. I suppose the collectives disbanded around about that time, and both the men's groups and the women's group were separately looking for other activities to become involved in. And it coincided with news coming from America that there was this new illness that was affecting gay men and not helped by the fact that it was called gay-related immune deficiency. So we quickly realised that it won't be long before that comes to Ireland. If it's a transmissible infection, obviously it would travel even at the levels it was back then. It would take a very small time to come to Ireland. So we decided we would organise around that, and I think it was in 1984 that groups of us got together, both from the Cork Gay Collective and Dublin Gay Collective, to look at what could be done. And we decided that our main approach would be in the area of education and information, and in particular risk reduction for the gay male community here in Dublin. And so we set about writing and drafting and publishing our first Gay Health Action leaflet. It was the first leaflet about HIV in Ireland, and we were the first organisation to raise the issue of concern and the first to address the community in terms of risk reduction messages.
And just looking at that first leaflet, how was it funded and what was the reaction to it? Was there much demand, and what was the messaging within that booklet as well?
Well, we fundraised independently to get ourselves off the ground. People may forget that gay male sex was illegal at the time, and so we were operating in the background of that context, I suppose. HIV had hit the media, and I suppose there was a lot of sympathy, particularly left-wing groups and in the arts, for the cause. So there were a lot of concerts that we did to organise funding for ourselves. AIDS to fight AIDS was a general slogan around the time. We also did apply to the Health Education Authority at the time to help fund the first leaflet, but when it came out there was considerable shock in relation to the content of it, particularly in relation to the graphic. I remember, I think it was Arthur Leahy from the Cork Gay Collective brought in this very small, it's like a postage stamp sized drawing of a line drawing of two men, two male bodies basically together in what was obviously an intimate embrace, but not an overtly sexual one. And we all thought, well, that's fine, it looks lovely and it's very discreet. And then when we sent to the designer, and I can't remember who the designer was, we had great designers at the time for all of our information leaflets, including John Brady and Declan's name I can't remember. He was excellent. Declan Buckley, yes, he was excellent in doing all of the various range of posters and so on at the time. And so when it came out, I remember that there was considerable protest from the straight community and indeed from the HSA, who had at the time contributed a small amount of money to it. they were criticised for funding illegal organisation and illegal activities, meaning, of course, that they were funding us to have safe sex, which was kind of missing the point, I guess.
Would it be fair to say that I suppose originally you would have started out targeting the gay community, but I suppose as the years went on and the government was that bit more silent and not producing the information that you were producing, that pressure came on Gay Health Action to reach out to the wider community and to start focusing on providing information outside the gay community as well?
Yeah, I suppose after the first leaflet, it would be fair to say that funding relations between ourselves and the health authorities was strained, and so we realised we'd have to take a different tack in relation to how we would progress things, and so there was a deliberate attempt to kind of broaden the information appeal to other affected groups, including haemophilias and drug users. And so I was also a founder member of Dublin AIDS Alliance at the time, which is now HIV Ireland. And at the time, the focus of the Alliance was really to bring together all the primarily affected groups to coordinate both information provision and also to jointly apply for funding. And so we took along that route. There were various general leaflets that were produced at the time, just what you need to know about HIV. There was a Women and AIDS leaflet. There were the Dublin AIDS helpline was set up and so on. So we kind of inaugurated a lot of services from that. I think we are, as you say, we were originally kind of targeting the gay men community, educating about risk reduction and so on, but it was very quickly into our campaign that we realized that people were crying out for information around what this was, how it was transmitted, how you could avoid it. And so we had teachers, educators, community organizations from different areas, different interests, different focus groups, all coming to us for information and advice around how to manage this. And our leaflets were used by, lots of unexpected resources, including for some reason we had a huge number of nuns, particularly nuns returning from the missions, who kind of got it. They were liberationist Catholics, I suppose, and they really took it to heart because they were aware of the impact of it in Africa, for instance, and the potential devastation it could have here. So they were very open to the information. But it was unfortunately some years later before the government decided to row in with information and campaigns of its own.
Gay Health Action, I suppose, developed a reputation as the organisation providing explicit information. I suppose that's most evident with the condom card, which you'll see if you come down. But you were also quite sex positive as well. I'm just wondering if you talk a little bit about the Joys of Sex poster and the messaging around that it wasn't, I suppose, casual sex, but rather was unsafe sex practices that was the primary issue that you were trying to address here.
Well, I suppose, as you can imagine, at the time there was a lot of debate around that between ourselves and the authorities around content of it. We had been looking at what was happening in other countries, in Britain and America particularly, but we were also obviously coming from a background of socialist left-leaning politics and wanted to advance the cause of LGBT rights from a positive perspective. So that meant being unapologetic about her sexuality. And the last thing we wanted to do was to go back to what seemed like a Catholic ethos of condemning sex for its own sake. We were really focusing on the fact that it's a virus that's transmitted in a particular way, and it's not about the number of partners that you have that affects your infection risk. It's about what you do with those partners. So we very early on took that focus and incorporated into all of our education leaflets and literatures. In terms of the Joys of Sex leaflet, I suppose there was some confusion in the early days about how exactly is it passed on, what can you do, what can't you do, and so along with others we kind of introduced a sort of traffic light system, a red, green, orange and high, medium, low sort of risk, and we compiled that into the Joys of Sex leaflet, which is really about a celebration of all the things that gay men can do together that are joyful, that are sexual, but that don't involve necessarily penetration or penetration without protection. And so it was a deliberately, focused on positive sex image, sexy looking graphics and images that we were using to get the message across. And they were very popular, those leaflets. I think they ran out more often than any other leaflet we've ever had. It was just a black and white line going like that, which would be very discreet.
Yeah.
But when it was blown up like that and coloured in pink, it was... Oh.